Monitored Anesthesia Care, MAC. Welcome to our comprehensive guide on monitored anesthesia care, often referred to as MAC. In this video, we'll explore what MAC is, its key components, the role of the anesthesia team, monitoring equipment, medications and sedation, patient assessment, the procedure itself, advantages, risks, and most importantly, patient safety. Let's dive in. What is monitored anesthesia care? To begin, let's define monitored anesthesia care. Definition and explanation of MAC. Monitored anesthesia care involves the administration of medications to achieve a state of conscious sedation and pain control while closely monitoring the patient's vital signs and overall condition. Unlike general anesthesia, where the patient is completely unconscious, in MAC, the patient remains conscious and able to respond to verbal cues and stimuli, but they are typically in a state of deep relaxation, and their pain and discomfort are effectively managed. Key features and benefits of MAC. Monitored anesthesia care, MAC, is a type of anesthesia service commonly used in various medical procedures. It involves the administration of anesthesia while continuously monitoring the patient's vital signs and adjusting the anesthesia levels as needed to ensure their comfort and safety. Here are some key features and benefits of MAC. 1. Consciousness preservation. One of the primary features of MAC is that it allows the patient to maintain consciousness. This can be particularly beneficial for procedures where the patient's cooperation or feedback is required. 2. Pain control. MAC ensures that the patient is comfortable and pain-free during the procedure. Pain medications and sedatives are administered to achieve this goal. 3. Patient comfort. Patients often experience less anxiety and discomfort during procedures performed under MAC, which can lead to a more positive overall experience. 4. Safety. Continuous monitoring of vital signs such as blood pressure, heart rate, and oxygen levels ensures the patient's safety throughout the procedure. 5. Quick recovery. Patients usually recover more quickly from MAC compared to general anesthesia because the effects of the sedatives wear off faster. When is monitored anesthesia care used? MAC is commonly used in a variety of medical procedures, especially those that are considered minimally invasive or do not require the patient to be fully unconscious. Some common examples of procedures where MAC may be employed include 1. Endoscopy. Procedures such as colonoscopy or upper endoscopy often use MAC to keep the patient comfortable and cooperative during the examination. 2. Dental procedures. MAC can be used for dental treatments like tooth extractions or dental implants, allowing the patient to remain calm while minimizing pain. 3. Minor surgeries. Some minor surgical procedures, such as skin lesion removal or cataract surgery, can be performed under MAC to provide analgesia and reduce anxiety. 4. Orthopedic procedures. Certain orthopedic surgeries, such as arthroscopy or closed reduction of fractures, can be conducted with the patient under MAC. 5. Pain management. In some cases, MAC may be used for chronic pain management procedures, such as nerve blocks or epidural injections. It's important to note that the specific choice of anesthesia technique, including whether to use MAC or general anesthesia, depends on factors such as the patient's overall health, the type of procedure, and the preferences of the medical team and the patient. The anesthesia provider will assess these factors and determine the most appropriate approach for each individual case. Components of monitored anesthesia care. Monitored anesthesia care, MAC, is a type of anesthesia used during certain medical procedures to ensure patient comfort and safety while allowing them to remain conscious or sedated to varying degrees. The components of MAC typically include 1. Anesthesia provider. An anesthesia provider is a licensed medical professional who administers and manages the anesthesia during the procedure. This provider can be an anesthesiologist, a nurse anesthetist, CRNA, or, in some cases, an anesthesiologist assistant, AA. They are responsible for assessing the patient's medical history, determining the appropriate anesthesia plan, administering medications, and monitoring the patient throughout the procedure. 2. Monitoring equipment. monitoring equipment is essential for tracking the patient's vital signs and overall condition during the procedure. Common monitoring devices used during MAC include electrocardiogram, ECG/EKG monitors the heart's electrical activity. Pulse oximeter measures the oxygen saturation of the patient's blood. Blood pressure monitor measures the patient's blood pressure. Capnography monitors the patient's exhaled carbon dioxide levels. Temperature monitor tracks the patient's body temperature. End-tidal carbon dioxide, EtCO2, monitor measures the concentration of carbon dioxide at the end of an exhaled breath. 3. Medications and sedation. In MAC, patients are typically given medications to keep them comfortable, relaxed, and sometimes lightly sedated. These medications can include local anesthetics, administered to numb specific areas of the body. Sedative medications, such as benzodiazepines or opioids, to reduce anxiety and discomfort. Analgesic medications, to control pain during and after the procedure. The choice and dosage of medications are tailored to each patient's specific needs and the nature of the procedure. 4. Patient assessment and evaluation. Before initiating MAC, a thorough patient assessment and evaluation are conducted to determine the patient's overall health, medical history, and any potential contraindications. This assessment helps the anesthesia provider create an individualized anesthesia plan and ensures the patient's safety throughout the procedure. Additionally, effective communication between the anesthesia provider and the patient is crucial during MAC to address any concerns or questions the patient may have and to ensure their comfort and well-being. These components work together to provide safe and effective anesthesia care for patients undergoing procedures that do not require general anesthesia but still necessitate pain management and monitoring. The goal is to balance patient comfort with safety while allowing them to remain cooperative and responsive during the procedure. The anesthesia team in monitored anesthesia care. The anesthesia team in monitored anesthesia care, MAC, consists of several key members, including the anesthesiologist, nurse anesthetist, and anesthesiologist assistant. Each member plays a crucial role in ensuring the safety and comfort of the patient undergoing a medical procedure. Effective collaboration and communication within the team are essential for providing high-quality care. 1. Anesthesiologist. Role: anesthesiologists are medical doctors, MDs or DOs, with specialized training in anesthesia. They are responsible for the overall management of the patient's anesthesia care. This includes assessing the patient's medical history and current condition, determining the appropriate anesthesia plan, administering and monitoring anesthesia medications, and adjusting anesthesia levels as needed during the procedure. Collaboration and communication. Anesthesiologists are often the leaders of the anesthesia team. They collaborate with other healthcare providers, such as surgeons and nurses, to ensure the patient's safety and comfort. They communicate vital information about the patient's condition, anesthesia plan, and any changes that may arise during the procedure. 2. Nurse anesthetist, certified registered nurse anesthetist, CRNA. Role: nurse anesthetists are advanced practice registered nurses, APRNs, with specialized training in anesthesia. They are qualified to provide anesthesia care under the supervision of an anesthesiologist or independently, depending on state regulations. Nurse anesthetists assist in all aspects of anesthesia care, from assessing the patient to administering and monitoring anesthesia. Collaboration and communication. Nurse anesthetists work closely with the anesthesiologist to provide safe and effective anesthesia care. They communicate with the surgical team and other healthcare providers to ensure a smooth and coordinated procedure. Collaboration may also involve discussing the patient's medical history and any specific concerns. 3. Anesthesiologist assistant, AA. Role: anesthesiologist assistants are healthcare professionals with specialized training in anesthesia. They work under the supervision of an anesthesiologist and are involved in tasks such as patient assessment, anesthesia administration, and monitoring. AAs help ensure that the anesthesia plan is carried out safely. Collaboration and communication. anesthesiologist assistants collaborate closely with the supervising anesthesiologist to provide anesthesia care. They communicate important information about the patient's status, assist in managing the anesthesia equipment, and follow the anesthesia plan established by the anesthesiologist. Effective collaboration and communication within the team. Regular and clear communication is vital within the anesthesia team. This includes discussing the patient's medical history, allergies, and any potential risks. Team members must establish a common understanding of the anesthesia plan and any modifications that may be needed during the procedure. During the procedure, ongoing communication ensures that the patient's vital signs, anesthesia levels, and overall well-being are closely monitored and any issues are promptly addressed. Collaborative decision-making is essential in handling unexpected situations or complications that may arise during the procedure. The anesthesia team in monitored anesthesia care works collaboratively to ensure patient safety and comfort. Each member has distinct roles and responsibilities, and effective communication and teamwork are crucial for providing the best possible care to patients undergoing medical procedures. Monitoring equipment of monitored anesthesia care. Monitoring equipment plays a crucial role in ensuring patient safety during monitored anesthesia care, MAC, which is a type of anesthesia provided to patients during certain medical procedures where local anesthesia alone is insufficient, and the patient's consciousness needs to be altered. Here's a description of some common monitoring devices used in MAC and how they contribute to patient safety. 1. Electrocardiogram, ECG. Description: an ECG machine records the electrical activity of the heart. It involves attaching electrodes to the patient's skin, which measure the electrical impulses generated by the heart. Patient safety: ECG monitoring helps detect any irregularities in the heart's rhythm, such as arrhythmias or heart block, which may be exacerbated by anesthesia. Early detection allows for prompt intervention to prevent adverse cardiac events. 2. Pulse oximeter. Description: a pulse oximeter is a non-invasive device that clips onto a patient's finger, toe, or earlobe. It measures the oxygen saturation, SpO2, level in the blood and provides a real-time pulse rate. Patient safety: monitoring oxygen saturation ensures that the patient is receiving adequate oxygenation. A drop in SpO2 levels can indicate respiratory distress or airway obstruction, enabling timely corrective actions to maintain oxygenation. 3. Capnography. Description: capnography measures the concentration of carbon dioxide, CO2, in exhaled breath. It is typically done through a small device attached to the patient's breathing circuit or a nasal cannula. Patient safety: capnography helps assess the patient's ventilatory status. Abrupt changes in CO2 levels can indicate airway problems or hypoventilation, enabling prompt adjustments to maintain proper ventilation and prevent hypercapnia. 4. Blood pressure cuff, sphygmomanometer. Description: a blood pressure cuff is wrapped around the patient's arm or leg. It measures both systolic and diastolic blood pressure. Patient safety: monitoring blood pressure is essential to assess the patient's cardiovascular stability. Fluctuations in blood pressure can be indicative of various issues, such as hypotension, low blood pressure, or hypertension, high blood pressure. Prompt intervention can prevent complications like organ hypoperfusion or bleeding. How monitoring ensures patient safety during MAC. 1. Early detection of complications. These monitoring devices provide continuous real-time data, allowing anesthesia providers to promptly identify any deviations from normal values. This early detection enables them to take immediate corrective actions, minimizing the risk of complications. 2. Customized anesthesia management. Continuous monitoring helps anesthesia providers tailor the anesthetic agents and techniques to each patient's unique physiology and needs, ensuring the right level of sedation and analgesia while maintaining safety. 3. Maintaining adequate oxygenation and ventilation. Pulse oximetry and capnography help ensure that the patient receives sufficient oxygen and that their ventilation is adequate, reducing the risk of hypoxia or hypercapnia. 4. Cardiovascular stability. ECG and blood pressure monitoring help assess the patient's cardiovascular status, allowing the detection of irregularities or trends that may necessitate intervention to prevent adverse cardiac events. Monitoring equipment in monitored anesthesia care is vital for patient safety by providing real-time information on the patient's vital signs, allowing anesthesia providers to promptly respond to any issues that may arise during the procedure and ensuring the patient's well-being throughout the anesthesia administration. Pressure. Allergic reactions. There is a small risk of medications and sedation of monitored anesthesia care. Monitored anesthesia care, MAC, is a form of anesthesia used during various medical procedures to provide sedation and pain management while allowing the patient to remain conscious and cooperative. The medications used in MAC. The purpose of sedation, and the associated risks and benefits are as follows. 1. Types of medications used in MAC. A. Sedative medications. These drugs are administered to induce relaxation, reduce anxiety, and promote comfort during the procedure. Commonly used sedatives include benzodiazepines, such as midazolam or diazepam, are commonly used to induce sedation and amnesia. Propofol, a short-acting sedative hypnotic medication often used for deep sedation in MAC. Dexmedetomidine, a selective alpha-2 adrenergic agonist used for sedation in MAC and has analgesic properties. B. Analgesic medications. These drugs are used to control pain and discomfort during the procedure. Common analgesics used in MAC include opioids, such as fentanyl or remifentanil, can provide effective pain relief. Non-opioid analgesics, such as ketamine, may also be used for pain management in MAC. 2. The purpose of sedation in MAC. The primary purpose of sedation in MAC is to ensure patient comfort and alleviate anxiety, pain, and distress during procedures that may be uncomfortable or painful. The goals of MAC sedation are to keep the patient calm and cooperative, provide pain relief and reduce discomfort, minimize awareness of the procedure, maintain the patient's ability to respond to verbal and tactile stimulation, enable the healthcare provider to perform the procedure safely and effectively. 3. Risks and benefits of sedation in MAC. Benefits. Patient comfort. Sedation ensures that the patient is relaxed and comfortable during the procedure, reducing anxiety and pain. Procedure facilitation. It allows healthcare providers to perform procedures more easily as patients are cooperative and still. Amnesia. Some sedatives induce temporary amnesia, which can be beneficial if the patient does not want to remember the procedure. Short recovery time. Patients typically recover more quickly from MAC compared to general anesthesia. Risks. Respiratory depression. Oversedation can lead to slowed breathing, which is a potential risk, especially with opioids and deep sedation. Cardiovascular effects. Some medications can affect heart rate and blood pressure. Allergic reactions. There is a small risk of allergic reactions to medications. Nausea and vomiting. Some patients may experience post-procedure nausea and vomiting as a side effect of sedation. Aspiration. In cases where patients may eat or drink too close to the procedure, there is a risk of aspiration, inhalation of stomach contents, if protective airway reflexes are impaired. The choice of medications, level of sedation, and monitoring during MAC should be carefully tailored to the patient's individual needs, the nature of the procedure, and the patient's medical history to balance the benefits of sedation with the potential risks. This decision is typically made by an anesthesia provider in consultation with the proceduralist and the patient. Patient assessment and evaluation of monitored anesthesia care. Assessing and evaluating patients for monitored anesthesia care, MAC, is a critical part of ensuring their safety and comfort during various medical procedures. MAC is a type of anesthesia that involves the administration of sedatives and local anesthesia to keep the patient comfortable and pain-free while allowing them to remain conscious and responsive. Here are the key steps in patient assessment and evaluation for MAC. 1. Preoperative assessment. Medical history. Gather a comprehensive medical history from the patient. This should include information about any chronic medical conditions, allergies, previous surgeries, medications, and any past experiences with anesthesia. Physical examination. Perform a thorough physical examination to assess the patient's overall health. Pay particular attention to the airway, cardiovascular system, and any potential anatomical factors that could affect the anesthesia administration. Laboratory tests. Depending on the patient's age and medical history, order appropriate laboratory tests such as blood tests, electrocardiogram, ECG, and chest X-rays to assess their baseline health. Assessment of airway. Evaluate the patient's airway to ensure it is clear and assess any potential difficulties with intubation or ventilation. Assessment of coagulation status. Assess the patient's coagulation status, especially if the procedure involves bleeding or if the patient is on anticoagulant medications. 2. Informed consent process. Explain the procedure, including the use of MAC, to the patient in clear and understandable language. Discuss the risks and benefits of MAC and any alternative anesthesia options. Ensure the patient understands the potential complications, such as respiratory depression, nausea, or allergic reactions. Provide an opportunity for the patient to ask questions and address their concerns. Obtain written informed consent from the patient or their legal representative. 3. Assessing patient suitability for MAC. Patient selection. Determine if the patient is an appropriate candidate for MAC. Not all patients are suitable for this type of anesthesia. Factors to consider include the patient's age, medical condition, and the nature of the procedure. Cooperation and understanding. Assess the patient's ability to cooperate and understand instructions during the procedure. Patients must be able to respond to verbal cues and maintain adequate ventilation. Monitoring capabilities. Ensure that the facility has the necessary monitoring equipment and personnel to provide continuous assessment and care during the procedure. Emergency preparedness. Be prepared for any potential emergencies or complications. Ensure there is a plan in place for the conversion to general anesthesia if needed. Anesthesia provider skills. Verify that the anesthesia provider is trained and experienced in administering MAC and can respond appropriately to any complications. Documentation. Document all aspects of the preoperative assessment, informed consent process, and patient suitability evaluation in the patient's medical record. It's essential to tailor the assessment and evaluation to each patient's unique circumstances, taking into account their medical history, the specific procedure, and any individual risk factors. Proper patient assessment and evaluation are crucial for ensuring the safety and success of monitored anesthesia care. The monitored anesthesia care procedure. Moving on to the procedure itself, we'll provide a step-by-step overview of MAC, including patient preparation, anesthesia induction, and maintenance. The monitored anesthesia care (MAC) procedure is a type of anesthesia used during certain medical and surgical procedures. It involves providing anesthesia to a patient while continuously monitoring their vital signs and level of consciousness. MAC is typically used for procedures that do not require general anesthesia but still necessitate sedation and pain control. Here is a step-by-step overview of the MAC process. 1. Patient evaluation. Before the procedure, the anesthesia provider, usually an anesthesiologist or nurse anesthetist, evaluates the patient's medical history, current medications, allergies, and overall health. The patient's physical status, age, and the complexity of the procedure are also taken into account to determine the appropriate level of anesthesia. 2. Informed consent. The anesthesia provider discusses the MAC procedure, its risks, benefits, and alternatives with the patient. The patient provides informed consent for the anesthesia and the procedure. 3. Preoperative assessment. The patient may be asked to fast, not eat or drink, for a certain period before the procedure, depending on the type of anesthesia and the procedure itself. Intravenous, 4. Access is established, allowing medications and fluids to be administered during the procedure. 4. Monitoring setup. Continuous monitoring equipment is set up to track the patient's vital signs, including heart rate, blood pressure, oxygen saturation, and electrocardiogram, ECG, if necessary. The patient's level of consciousness is assessed throughout the procedure. 5. Pre-anesthetic medication. Depending on the patient's anxiety level and medical condition, pre-anesthetic medications may be administered to help relax the patient. 6. Local anesthesia. Local anesthesia is often administered at the site of the procedure to numb the area and reduce pain. 7. Sedation. The anesthesia provider administers sedative medications, typically through the 4, to induce a state of relaxation and reduce discomfort. The level of sedation is carefully titrated to keep the patient comfortable but responsive. 8. Anesthesia maintenance. Throughout the procedure, the anesthesia provider continually assesses the patient's vital signs and level of consciousness. Additional doses of sedative medications or analgesics, pain relievers, may be given as needed to maintain the desired level of anesthesia and pain control. 9. Communication. The anesthesia provider communicates with the surgical team and the patient throughout the procedure to ensure the patient's comfort and safety. 10. Procedure completion. Once the surgical or medical procedure is complete, the anesthesia provider gradually reduces the administration of sedative medications. The patient is monitored as they regain full consciousness and become more alert. 11. Post-anesthesia care. After the procedure, the patient is taken to a recovery area where their vital signs and level of consciousness are closely monitored. The anesthesia provider ensures the patient is recovering well and manages any post-procedure pain or discomfort. 12. Discharge or transfer. Depending on the patient's condition and the procedure performed, they may be discharged home or transferred to a postoperative care unit for further monitoring and recovery. It's essential to note that the specifics of the MAC procedure can vary depending on the patient's individual needs, the type of surgery or procedure, and the healthcare facility's protocols. The goal of MAC is to provide effective anesthesia and pain control while minimizing the risks associated with general anesthesia. Advantages of monitored anesthesia care. Monitored anesthesia care, MAC, offers several advantages in the context of anesthesia administration. Here are some key benefits. 1. Enhanced patient comfort. MAC allows patients to remain conscious and aware during the procedure, which can reduce anxiety and improve overall comfort. Patients may also be able to communicate with the anesthesia provider and surgical team, addressing any concerns or discomfort promptly. 2. Reduced risk of complications. Since MAC is typically administered by a specialized anesthesia provider who closely monitors the patient's vital signs and adjusts anesthesia levels as needed, it can reduce the risk of complications associated with general anesthesia. This personalized care can lead to better outcomes, particularly in patients with certain medical conditions or those at higher risk for anesthesia-related issues. 3. Faster recovery times. Compared to general anesthesia, patients who undergo MAC often experience shorter recovery times. They may wake up more quickly after the procedure and have fewer lingering effects, such as grogginess or nausea, which can speed up their overall recovery process. Examples of procedures where MAC is commonly used. MAC, monitored anesthesia care, is a type of anesthesia commonly used in various medical procedures to provide sedation and pain management while allowing the patient to remain conscious and responsive. 1. Endoscopy and colonoscopy. Many gastrointestinal procedures, such as endoscopies and colonoscopies, are routinely performed under MAC. Patients are sedated and monitored during these procedures to ensure comfort and safety. 2. Cataract surgery. Cataract surgery is often performed with MAC, allowing patients to stay awake and aware during the procedure while minimizing discomfort. 3. Dental procedures. Some dental surgeries, like wisdom tooth extraction or dental implant placement, can be performed under MAC, providing effective pain control and reducing anxiety for the patient. 4. Orthopedic procedures. Certain orthopedic surgeries, such as joint arthroscopy or fracture repair, can be done under MAC, allowing the patient to maintain some degree of consciousness and control over pain management. 5. Plastic and cosmetic surgery. Many elective cosmetic procedures, such as breast augmentation or liposuction, can be performed under MAC, giving patients the benefit of being awake during their surgery while ensuring their comfort. 6. Biopsy and minor skin procedures. Skin biopsies and minor surgical procedures are often performed under MAC to keep the patient relaxed and pain-free while ensuring a rapid recovery. It's important to note that the choice between MAC and general anesthesia depends on various factors, including the patient's medical history, the nature of the procedure, and the preferences of the patient and surgical team. The anesthesia provider will assess these factors to determine the most suitable anesthesia technique for each case. Risks and complications of monitored anesthesia care. Like any medical procedure, MAC comes with potential risks and complications. We'll discuss these in detail, how healthcare providers mitigate these risks, and the importance of patient education and consent. Monitored anesthesia care, MAC, is a type of anesthesia used for certain medical procedures where the patient remains conscious and able to respond to verbal commands while receiving medications to minimize discomfort and anxiety. Although MAC is generally considered safe, there are potential risks and complications associated with this type of anesthesia. Healthcare providers take various measures to mitigate these risks, and patient education and informed consent play a crucial role in the process. Potential complications associated with MAC. 1. Respiratory depression. One of the primary concerns with MAC is the potential for respiratory depression, where the patient's breathing becomes slow or shallow. This can occur due to the medications used, and it's important to monitor the patient's oxygen saturation and respiratory rate closely. 2. Cardiovascular complications. Some patients may experience changes in blood pressure or heart rate during MAC. This is especially important to monitor in individuals with pre-existing heart conditions. 3. Allergic reactions. There is a risk of allergic reactions to the medications or other substances used during MAC. This is relatively rare but must be considered. 4. Nausea and vomiting. Some patients may experience postoperative nausea and vomiting, PONV, after MAC, particularly if they're prone to it. Anti-nausea medications can be administered to mitigate this risk. 5. Neurological complications. In rare cases, patients may experience neurological issues such as confusion or memory problems after MAC. How healthcare providers mitigate risks. 1. Patient assessment. Before administering MAC, healthcare providers thoroughly assess the patient's medical history, current health status, and any potential risk factors that may affect anesthesia. 2. Monitoring. During the procedure, healthcare providers continuously monitor the patient's vital signs, including heart rate, blood pressure, oxygen saturation, and respiratory rate. This allows for early detection of any complications. 3. Medication selection. Anesthetic medications are carefully chosen based on the patient's needs and medical history, with consideration of their potential side effects. 4. Dosage control. Healthcare providers ensure that the medications are administered in the appropriate dosage to minimize the risk of adverse effects. 5. Emergency preparedness. Healthcare facilities equipped with MAC capabilities have emergency equipment and medications readily available to manage any unforeseen complications. Patient education and consent. Patient education and informed consent are critical components of the MAC process. Patients should be provided with detailed information about the procedure, the type of anesthesia, MAC, potential risks and complications, and alternative options. This allows patients to make an informed decision about their anesthesia and treatment plan. Healthcare providers should also address any questions or concerns the patient may have. Informed consent involves obtaining the patient's voluntary agreement to proceed with MAC after understanding the risks and benefits. Written consent is typically obtained to document this agreement. In summary, while monitored anesthesia care, MAC, is generally safe, it is not without potential risks and complications. Healthcare providers take several measures to mitigate these risks, including thorough patient assessment, continuous monitoring, careful medication selection, and emergency preparedness. Patient education and informed consent are crucial to ensure that patients are well informed and actively participate in their anesthesia decisions. Patient safety in monitored anesthesia care. Throughout this video, we'll emphasize the paramount importance of patient safety in MAC. We'll discuss strategies for monitoring and intervention, as well as the ongoing efforts to improve safety protocols. Patient safety is paramount when it comes to monitored anesthesia care, MAC. MAC is a type of anesthesia used for various medical procedures, and ensuring the well-being of patients undergoing MAC is a top priority. Here, we will emphasize the importance of patient safety in MAC and discuss strategies for monitoring and intervention, as well as the need for continuous improvement in safety protocols. 1. Priority of patient safety in MAC. Vigilant monitoring. The core principle of MAC is to provide anesthesia while allowing the patient to remain conscious and responsive. This requires continuous monitoring of the patient's vital signs, including heart rate, blood pressure, oxygen saturation, and respiratory rate. Ensuring these parameters remain within safe ranges is critical to prevent adverse events. Individualized care. Each patient is unique, and their response to anesthesia can vary. Therefore, a thorough preoperative assessment is essential to identify potential risk factors and tailor the anesthesia plan accordingly. This may include assessing the patient's medical history, allergies, and any medications they are currently taking. Clear communication. Effective communication among the anesthesia team, surgical team, and nursing staff is vital. This ensures that everyone is aware of the patient's condition and can respond promptly to any changes or concerns. 2. Strategies for monitoring and intervention. Advanced monitoring technology. Utilize state-of-the-art monitoring equipment and technology to continuously assess the patient's vital signs. These systems can provide real-time data and alerts in case of any abnormalities, allowing for rapid intervention. Experienced anesthesia providers. Ensure that anesthesia providers are well-trained and experienced in administering MAC. They should be capable of recognizing early signs of complications and taking appropriate action. Emergency protocols. Develop and rehearse emergency protocols specific to MAC. This includes procedures for airway management, cardiac arrest, and other critical events that may arise during anesthesia administration. 3. Continuous improvement in safety protocols. Regular training and education. Keep the anesthesia team up to date with the latest guidelines, best practices, and advancements in MAC. Regular training and educational sessions are essential to maintaining a high level of competence. Audit and review. Establish a system for auditing and reviewing MAC cases to identify areas for improvement. This can include analyzing adverse events, near misses, and patient outcomes to refine safety protocols. Patient feedback. Encourage patients to provide feedback on their MAC experience. Their input can be valuable in identifying areas where improvements can be made, such as communication, comfort, or anxiety management. Quality assurance. Implement a quality assurance program that involves ongoing monitoring and assessment of MAC practices. This can help identify trends and areas in need of improvement. Patient safety should always be the top priority in monitored anesthesia care. By emphasizing vigilant monitoring, individualized care, and effective communication, along with implementing advanced monitoring technology and emergency protocols, healthcare providers can ensure the safety of patients undergoing MAC. Furthermore, continuous improvement through training, audit, patient feedback, and quality assurance programs is crucial to maintaining and enhancing the safety of this anesthesia technique.